Welcome, and thank you for listening to the Crookston Pet Clinic Network. Today we feature Todd, the 2-year-old collie mix, getting his teeth cleaned. Dental care is an important part of your pet's health. We are excited to show you the behind-the-scenes process of our teeth cleaning procedure. So sit back, relax, and learn. As you can see here, Todd has willingly and excitedly come into the back treatment area to donate a blood sample. We will use this sample to run a full panel that takes a look at his red blood cells, white blood cell counts, kidney, liver, and other vital organ functions to make sure that he is an ideal candidate for anesthesia. If there were to be any causes for concerns or an increased risk for this procedure, we always call the pet's owner to discuss this further prior to the anesthetic. Dr. Leah is now placing the blood sample from Todd in 2 different tubes. The green top tube is used for his chemistry profile, while the purple top tube is used for his CBC. The other blood test that we do is what is called a 4DX test. It tests to make sure that the dog does not have heartworm, Lyme disease, Ehrlichia, and anaplasmosis. All dogs must have a current test done within the year on file. If they do not, we perform one prior to anesthesia. The reason for this is to primarily make sure they do not have heartworms. This deadly disease can complicate the anesthesia and can cause major harm to your pet, which is why we require a negative test on file. This is our anesthesia machine. It will provide Todd with oxygen and isoflurane during his procedure to keep him asleep. These 2 machines are running our CBC and chemistry profile. This page here is what we used to input the information. It also provides all of Todd's needed information for the day for us. While Todd's blood work runs, which typically takes about 20 minutes, we'll get a weight on Todd. So we bring him up to the front to get an accurate weight on him today. This is important as we want to make sure that his drug doses are accurate. So now that Todd's blood work looks great and there are no concerns on it, we are going to sedate him. So here Dr. Leah is pulling the anesthetic drug from the vial into a syringe, and Dakota, our assistant, is hanging out with Todd on a towel so that when he does fall asleep, it'll be a nice soft landing. And what she does is she holds off the vein as Dr. Leah holds the leg. Dr. Leah will then insert the needle and insert the drug into Todd. It does not take very long for the anesthetic drug to start working. So Dakota makes sure that she stays with Todd the entire time so that when he does start to go down and fall asleep, that she's there to catch him and make sure that the landing is very soft on the towel. Todd is now being lifted up onto the treatment table so he can be prepped for his dental procedure. Here we have Dr. Leah prepping what is called an Aspergard. It is a sponge-like material that expands when wet and goes around the endotracheal tube. It prevents debris, whether that's plaque, tartar, or prophy paste that we use to polish the teeth, from falling back into their trachea during the dental procedure. So it's a sponge-like block that prevents that from happening. So now the technical assistant is going to take the endotracheal tube and place it in Todd's trachea. This allows him to receive oxygen and anesthesia during the dental procedure. We have varying size tubes for varying size dogs so that we have a good fit for each dog or cat. I'd like to stress that during this procedure, Todd is not aware of what is going on. He is sedated, and while there is some coughing while the tube is placed, that is a normal response to the tube placement. It does allow us to make sure that we did place the tube properly. And then once the tube is placed properly, we inflate the cuff, and that is at the bottom of the tube, and it's similar to the Aspergard. It allows to prevent the possibility of fluid or any debris from going down his trachea. Here, Dr. Leah is placing what we lovingly refer to as the space blankie onto Todd's back. It is of actually NASA designed, and it uses their own body heat to regulate their temperature. Typically with anesthesia, animals and people lose body heat. So this helps them maintain their temperature so that they do not become too cold. The next step in the procedure is for us to shave a spot on Todd's leg so that we can place the IV catheter. The IV catheter allows Todd to receive fluids during his procedure. We administer fluids to pretty much all of our patients who undergo anesthesia. Not only does it give them that support there, but if they were to start waking up early from their anesthesia before we get them onto the anesthetic machine, or if there were any complications, it allows us to get to the cardiovascular system with those medications to help the patient quickly and easily. Now that Todd has been completely sedated and is completely unaware of his surroundings and asleep, we can get started on his dental procedure. As you can see here, our technical assistant is using a periodontal probe on the gum line of Todd's teeth to make sure that there aren't any pockets or issues with the root or the base of the tooth. So that is what she is doing, and she will do that on both the top and bottom teeth on both sides. Meanwhile, during the entirety of the procedure, vitals are taken on Todd. We monitor his heart rate, his respiration, as well as his temperature to make sure they're all within normal range. These measurements are taken between every 5 and 10 minutes, depending on the patient, and are reported on a piece of paper, which is then put into their file at the end of the day. Now that the periodontal probe has been used, the assistant is going to take the dental scaler and scale and clean each of Todd's teeth. Once the teeth scaling has been complete, it is now time to polish the teeth using our dental polisher and Profi paste. It is a special paste designed to use after the scaler to make sure that any surfaces that have been scratched or marked on by the scaler are filled in and polished smooth to prevent plaque and tartar buildup from coming back sooner. Now that Todd's teeth have been cleaned and polished on the first side, it's time to flip him over so we can get at the second side. We always unhook our anesthesia patients from the anesthetic machine as we flip them over. The reason for that being we do not want to uncomfortably disturb the endotracheal tube that has been placed. We also make sure that when we are turning them over that it is from side to side with their head facing down and not over their back. The reason for this is if the dog or cat were to vomit and us not know about it during the procedure, during this motion, it would come out of the mouth versus going back down into their throat or trachea, causing further problems or issues. Once we finish the scaling and polishing procedure on the other side, it's time to get the instruments put away and wait for Todd to wake up. Next, we're going to remove the IV catheter from Todd's leg. We use a gauze square and a small piece of vet wrap to do so. And that Band-Aid is on there for the next couple hours and is removed before the patient goes home. Once the patient starts to wake up and they have the ability to swallow, we will remove the endotracheal tube from their trachea and assist them in an upright position to allow them to further wake up. Once the patient seems stable and is able to sit up on their own, we place them back in their kennel so that they may continue to wake up in a safe environment, and we constantly are there checking in on them to make sure everything is okay as they do so. And that concludes our dental with Todd. He was a great patient with some great teeth, and we recommend you giving us a call sometime soon and getting your pet scheduled for their dental exam as well. Have a great day.